The O shot, or platelet-rich plasma into the G-spot and clitoris, is a painless, let's start with all of that, a painless procedure in which we use platelet-rich plasma to enhance orgasmic capability in females, as well as a way to address stress urinary incontinence. And that's the type of incontinence when a woman coughs, sneezes, laughs, and she tends to leak a little bit. As a urologist, if I could have used this procedure decades ago, I would have been so happy. There are so many women who suffer through minor incontinence that either put up with it or they undergo costly, dangerous, painful surgeries that can be, if not cured with this procedure, vastly improved. And what we do is we take your body's own platelet-rich plasma, which we've described before, and we carefully inject it in selected areas. For sexual enhancement, we will place it into the G-spot and the clitoris particularly. And again, this is going to be painless. As a urologist, I know how to anesthetize and make these areas numb. It is so bearable, if not completely painless. People oftentimes don't even know that they've had the procedure done. For women who are suffering incontinence, we may concentrate more on the G-spot area underneath the anterior vaginal wall, or where the urethra is in the vagina, to help with this incontinence that you get when you cough or sneeze. When do you see results? Some women are going to see results as quickly as that day. We tell them, though, the platelet-rich plasma has to do its work, and the results might take a few weeks to a few months to know for sure. Many women choose to get more than one treatment because they find that additional treatments will compound or even make the first result even better. How long will it last? Everybody's different. Some will get a procedure and never have to do it again. And some will get a procedure maybe once a year to just maintain it and keep everything the way it is. As far as the sexual aspect, well, of course, that's going to be completely individualized, but let's just say it would not be one of our most popular procedures if it wasn't so popular, and that should speak for itself. Again, there is really no pain involved whatsoever. There's no downtime. You can go back to your usual activities that evening if you'd like, to be quite honest. So, for women that are suffering needlessly, why not try this? If the results work for you, then they're spectacular, and there's nothing to risk. And we've been doing this in Biltmore Restorative Medicine now for years. We're a proud instructor in this technique, and where we teach other physicians, nurse clinicians how to do this. And as a urologist, this is part of the anatomy that I've dealt with for decades and feel very comfortable helping women with.